Good morning, everybody. Welcome to MedCost's April 22nd episode of our, I guess we'll call these our clinical conversations, these Q&As with panelists from MedCost's clinical team. We've got just a minute, so before we get into the questions today, we will let people take their time joining in. So I'll start again, or start for real next time at 11:30. We live in a time where meetings are more back-to-back than they've ever been. I'm watching the attendee list click up now, so we'll wait until everybody gets on. We'll go ahead and get started. Several people have been, look at the attendee list, several of you have been here with us before in the prior months. We're excited today to be discussing population health. We have some familiar faces from MedCost's clinical team on with us to answer questions around population health. Some quick housekeeping items. In the control panel, which should be in the right of your screen, there's a little box. There's a questions tab. You can feel free to click there and ask any questions that you have of us. If we have time permitting, we do have some prepared questions based on feedback earlier or before the session. We will gladly insert new questions where we can, when we can, or if you have additional questions for the topic we're discussing, please provide those in the questions panel. Everybody is muted, so you won't be able to unmute yourself and talk. It's one of those GoToWebinar features just to protect the flow of the conversation. And our speakers today, in fact, it looks like I have not shared their bios out. So if you'd like to get a bio, for sake of time, we have 30 minutes and a very meaty topic to discuss today. So I'm not going to go through introductions. Bios will be available upon request. Post a question and I'll email them to you. Today we're talking about population health. Population health, the way I think about it, is like at the halftime show in the marching band, the camera guy is zooming in on the trumpet player or the color guard or the drummer, and then they flash and look down and you see this beautiful picture, which may be the school logo, right? That's kind of this conversation. It encompasses everything we've talked about so far and the topics we're going to talk about. I'm really about the human being, but that's how I view it. Let's ask some experts about it. The first question we have is simply, what is population health? So Jackie, I'll let you lead and tell me if you're going to answer somebody else. So Jackie Allen, what is population health?
Sure. Thank you, Curtis. And I'll give a start to it and then invite the rest of the panelists to add anything that I may leave out. But really what population health management is a way to address all of the healthcare needs of the population across the entire care continuum. So what that really means is it's not just healthcare anymore. It's also social needs, financial needs that do drive healthcare outcomes, but it's an approach to being able to identify and manage those needs across the entire care continuum that really results in having the healthiest outcomes within the population that are possible.
Awesome. Anybody have anything else to add to that? I think it's a great introduction to population health. Awesome. Okay, so here's I guess the natural follow-up question number 2 that we have. Why does it matter, right? Why should population health matter to an employer?
And I will start again on that, Curtis, and again ask my panelist companions to add in as well. But I mean, there are a lot of reasons population health should matter to an employer. Number one, just having a healthier overall population helps with productivity, job satisfaction, employee retention, things of that nature from a population perspective. Importantly, it helps to reduce cost and utilization with your health plan expenses. Studies within the industry and expert bodies have research to show that employers that actually invest in employee population health, they typically save on average a 6-to-1 return on investment by promoting the right population health programs with their staff and their employees. And what's great about it is when one employer does it, typically that translates to other employers in the communities taking similar approaches. And it really starts to grow as a community investment versus just an employer specific investment.
Yeah, and Jackie, I would add on to that too, that it is important to address all the different levels of needs that do arise on that continuum, because the levels of need are completely, well, I say completely different. Oftentimes there's a commonality. So there are certain preventive measures and certain needs that can really occur across everything. But then we really have to carve out and say, okay, for our higher cost claimants, for those that are really higher up on that scale, you know, their needs are much more intensive, but at the same time, we cannot forget about the majority of the population that falls in that healthy and well category. So I think to really bring light to the fact that, yes, there are commonalities amongst the needs, but we do still have to carve out and look at what are the different, like, what's the differentiator as well.
That's a great point. Great point. It's you know, the temptation to focus on those complex cases, you know, because they're so present. And you know, we talk all the time about how I talk a lot about, well, a lot of things, but specifically in this case, I talk a lot about the objective of a health plan isn't to pay less for it, right? That's a requirement of a health plan, right? To control healthcare spending. It's there for a different reason, you know, and that's what we're talking about.
Yep. And Curtis, if I can, something else that just came to my mind as we, you know, before we dive into some of the other questions in more detail as well, I think we also have to recognize that so often when we talk about population health, I think our minds initially go to the physical health component. But I think so importantly now is that we also realize that population health also includes behavioral health. So when we're talking about these needs and, you know, the different levels upon the spectrum, we need to be thinking about this in terms of behavioral health conditions as well, and not just those high cost claimants that we go to with, you know, oncology, transplant, you know, things like that. We need to also be thinking of the intensive behavioral health therapies and conditions, and the importance to keep everybody back in that healthy and well category as well. So I think we have to bring the behavioral health piece to the conversation too.
It's certainly the underlying connection to it. You know, how many times you see, you're looking at comorbidities with all the complex, whether there's diabetes or whatever, there's always some type, not always, but there is very commonly some connection to some behavioral health component. I think that's an awesome point, Katie.
I think that's critically important as well, Curtis. And I would also even take that even further to what Katie shared and say it's even beyond both medical and behavioral. We're now into an age where social factors play such an important role in population health. And I think the COVID pandemic has probably shown us all worldwide, of course, in the US and definitely within the healthcare communities, how influential those social factors are. Basic things like housing, transportation, how you can access your health care, and how that health care can be delivered in a fashion that is most convenient for each member has become vitally important.
Absolutely. So any other thoughts on the importance of population health to an employer? Welcome, Donna. Donna had some technical difficulties. She wasn't late. It was a GoToWebinar challenge, but I wasn't not engaged. I was over here scurrying to try to find out how we get Donna into the panel. So welcome, Donna.
Yeah, I appreciate the lifeline, Curtis. Thank you.
So now we get into, we've talked about why. Now we're going to get into the meaty, the tough stuff, right? So how does an employer stand up, start or implement their population health strategy? Because there's so much they can do, so much that needs to happen. How do they get started?
Yeah, I would go back to what Katie just mentioned about it's honestly unique to each employer. Every employer's population is going to have individualized needs, so it's not a one size fits all strategy. And where an employer really needs to start is around the analytics. The analytics are going to be what inform as far as what is most meaningful to that population. So an employer should really start by spending some time and looking at their data and seeing what actionable insights and trends they can identify from their data. You know, we see cases, for example, you may have an employer that has over half of their population are females in childbearing ages, and what's going to be important to them is most likely a maternity management program. That's going to be very impactful for that employer, but another employer maybe 20 miles away may have the majority of their population being older males, 50 to 65 years old. What's going to be a very impactful strategy for that employer is probably going to be more focused around preventive screenings, making sure that, you know, those prostate screenings and colonoscopy screenings that should begin to happen at that age is the right strategy for that particular employer to start to administer. And both strategies are correct. Again, it's just very individualized for what's happening within the trend of that particular population. And then the other piece, and Katie referenced this as well also, is making sure that program, whatever the employer finds in their trends that they need to stand up, making sure it's holistic. It may be a behavioral health need is driving the need within that population, like Katie mentioned. With COVID, depression rates have skyrocketed across the country, and they were already rising even prior to the pandemic. So even just being able to start there on the mental well-being for most employers would be a good strategy. And then I would actually ask Zafira to weigh in from a pharmacy perspective, because there's definite advantages of having a pharmacy component in that initial startup strategy for an employer.
Yep.
Zafira,
Yeah,
would
good
you
call out. Yeah, I'd be happy to. And that's a great point, Jackie. I completely agree. And a lot's happening in the pharmacy space right now, and I feel like it has been for the last maybe 5 or 10 years or so. It's really exciting time in that space, but it's also, we're seeing a lot of dollar signs happening in that space as well. So I think it's really important to make sure that you have strategies in place to obviously manage those really expensive medications. I'm sure a lot of people have seen in the news or read about the gene therapy products that are recently been hitting the market. Those are really exciting because we're treating conditions that previously were essentially untreatable, and a lot of them are in kids too. So it's really exciting, but again, it comes at a cost, quite literally, when you see the price tags for some of these drugs. So you want to make sure that you're offering coverage for those, but it's important to make sure that you have measures in place within your plan that are making sure that it's the right medication for the right person at the right time. And then also feel like I can't skip over the importance of medication adherence here. So in our chronic conditions, you know, it's really important that these people are taking those medications. And I know that sometimes they are expensive, especially in the diabetes space. But you don't want to have barriers in place within your plan that make it impossible for members to get these medications, because they are so important for them to continue to take them. And honestly, the cost of the medication over time will end up being less than the potential healthcare costs that could come if individuals just stop taking their medications.
That's a great point, Zafira. I mean, it's hard sometimes. Yeah, I think Zafira and I, and we have talked about this in last month's panel conversation, but the fact that some people just get frustrated, or maybe they're financially they're unable to refill a prescription, and it doesn't kill them, right? So they're thinking, well, I'll just try harder, I'll eat better, right? I'll do something else. You know, if you ever lived with or been around somebody having challenges with their blood sugar, right, it affects a lot of things, you know, mental acuity, mood, and if it's just important to people, right, in our connections in our communities. I think it's a great call out.
Yeah, you really want to have programs in place that support your employees so that they know where to go when they have questions or they need help with things like that, like affording their medications and such.
Great. So Well, before I'm going to ask a second level question of Jackie regarding analytics, but if anybody else, any other or thoughts or contributions, suggestions for an employer who's saying, look, I'm ready to start doing something about the things that are driving the cost of healthcare and affecting my employees' productivity and their well-being. Any other ideas, thoughts, things that employers should keep in mind as they get started with their population health strategy?
I would just add that employers should be very open to being creative when thinking about their population health strategies. There are so many community-based programs available through the local churches, just the local wellness agencies that really fill a lot of the gaps that are common across the population, and they're extremely, very accessible, very low cost, and very willing to help dive into these spaces. I would just encourage employers to look at what's available to them locally.
Well, and Jackie, I was thinking really similar to that, and that an employer needs to look at the cultural piece as well. So even though your employees are showing up maybe to an office at the same place every day, where do they work? Where do they live? But where do they play? What are the other facets of their life? Because the work is just, maybe they're physically there, or now virtually, but where else can you meet the health? Where can you meet your members from a cultural perspective, rather than what you think makes sense from the clinical, just looking at it through a clinical lens. You've got to look at it through that cultural piece as well.
That's awesome, Kate. It actually kind of sits well with what, looping back to what Jackie said at the start, understanding what's happening in the population.
Yes.
Just in general,
Yes.
which leads to a kind of a second level question, Jackie. So an employer is, maybe they're fully insured today, and they've been buying insurance to cover, that's their health plan, all of it. But they recognize they want to do something, whether they're planning to go self-funded down the road, they need to get a handle on the claims or a handle on the outcomes, or they simply purely value the productivity and the well-being of their employees. When they're moving into analytics to look, what are the first things they're looking for, and how do they go about that when they're trying to assess the situation?
Right, meaning what should be some of the key points they try to dive into when looking at all of the data, because there is a lot of data. There's a lot.
It's constantly changing.
Yeah, you could go down so many pathways. You're exactly right, Curtis. So really one of the key areas that I would recommend employers begin to look at is their chronic condition burden within their population. So what portion of their employees or their health plan membership, what portion of those individuals have diabetes or high blood pressure or asthma or congestive heart failure, things like that. Typically that represents on average about 30% of the population. So when you think about being able to put something in place, a strategy that can make a large impact on a significant portion of the population and can help to better control spend, looking at those chronic conditions would probably be one of the first areas I would recommend looking at. The other is really the preventive screenings. Quite honestly, trying to make sure, really focusing on those preventive screenings to make sure those individuals are at least being evaluated from a preventive perspective, so that you don't get that late stage colon cancer diagnosis because you've never had a colonoscopy before when you should have. That helps on all realms with treatment plan, quality of life, saving the health plan money because you're diagnosing these things as early as possible. So those would be my two recommended strategies out of the gate.
Love it. Good actionable stuff. Doesn't necessarily cost a lot of money, if any, necessarily, just to be aware. And the chronic conditions are affecting their work in almost every case.
Yeah,
Very cool.
and I would just add a little more to that, Curtis, just to help the audience just be aware. With technology changes within healthcare, a lot of those screenings now, they're like in the colon screening perspective, those things can be done at home now. So from a convenience perspective, there are a lot of avenues now that promote adherence to having those screenings done, whereas in the past, individuals would be more apprehensive to go and have a full colonoscopy done to satisfy that preventive screening. Now there's a lot more convenient, cost-effective ways to be able to manage that.
Oh, that's awesome. That's very cool. Well, you know what? That's a great segue, Jackie, because the next question is talking about those changes. We've talked about why to do it, how we do it. We've talked about getting started. So for those in the audience who are already engaged, what are some of the trends happening now, the exciting things that are happening, like what you just talked about, and forward looking, right? What are the future expectations for population health? And I don't know who wants to go first. Jackie, I guess it's natural to start with you. I'll let you quarterback it around the panel.
Sure, I'll offer out a few and then others jump in as well. I would say, in addition to what we just talked about, it still goes back to data. You're going to see continued trends in the advancement in the use of data, really in the artificial intelligence and machine learning world. So we're going to get smarter in how we use the data across the industry and really try to use that technology to identify risks and gaps within the population much sooner so that we can intervene and prevent those from progressing. So we're seeing that happening, and I expect that to only continue across the healthcare system. I think it's going to be a little bit more challenging being able to harness that and deliver the right interventions, just because, again, individuals are receiving their care in so many different ways now due to the pandemic, which is another trend I would expect to continue. Not only have the telehealth services increased, and we expect that to continue, but really multimodal outreach and engagement with patients is going to become more prevalent. So that may look like very new types of delivery models that we haven't seen in the past. And then the other primary trend I would emphasize is the impact that we're seeing across the industry from value-based care initiatives. So thinking about things like patient-centered medical home, accountable care organizations, things like that, where what we're doing is coming together as a healthcare industry, working with providers, and providers are moving from a fee-for-service platform to a value-based care platform where they are taking on their own risk to some degree and making sure that they're managing the population based on the quality of care of the outcomes, so how healthy they can manage the population versus just a flat cost for the services that they render. So it's a much more invested delivery model on the outcomes of the population.
Right. What other trends are we seeing for the other panelists? Zafira, what about pharmacy?
Yep. Well, earlier, Curtis, I mentioned gene therapy, which is a key trend that we're seeing in the pharmacy space. We're also seeing, specifically for cancer treatments, CAR T therapies, which are kind of a newer, innovative treatment and might even end up changing the way that we manage cancer over the next decade or so. Again, those are the really expensive treatments, but they really are life-changing. There's a ton of them in the drug pipeline right now, so we're expecting to see a lot more hit the market over the next few years. But I do have some good news here, and that is that we're starting to see more generics enter the market too. So the generic versions of medications are typically about 80, maybe even 90% less costly than their brand name counterparts. And this is becoming especially important and impactful in the chronic condition space, where individuals are, of course, regularly taking medications for a lengthy period of time. So at this point, most of the reflux and heartburn medications have gone generic, which is great. And over the past 1 to 2 years, we've started to see a number of the inhalers for asthma and COPD go generic. Again, that's great news. It's starting to lower costs in the chronic condition treatment space. Hoping to see that trend follow in the diabetes space soon as well. So it's really important to make sure that you have measures in place under your pharmacy plan, either through your formulary or through some sort of utilization management strategy that encourage or maybe even require your employees to choose those generic versions when they're available, because we know they work and they're less costly. So there was some good news there in the pharmacy space too.
Well, we were talking. Oh, go ahead. Sorry.
Sorry. No, go ahead, Curtis.
I was just going to ask if you can share anything about, we've seen so many of these alternative funding strategies popping up for folks who maybe have a cost barrier to some really great medications that are just so expensive.
Yep, absolutely. So that's kind of a new trend we're seeing over the past few years. And what Curtis is referring to is essentially like a manufacturer assistance program. So a lot of the drug manufacturers for these really expensive medications actually offer funding to help cover those costs. And we're seeing some programs out there that their main goal is really to look for those sorts of dollars to, of course, help the member afford their medication, but more recently to also help the plan with the cost of those medications. Because as you all know, typically what happens with a $5,000 drug, the member probably only pays maybe $100 of that, and then the plan's on the hook for the rest of the cost. So these new programs are really innovative in that they look for those dollars from manufacturers or other grant funding and actually help the plan save money on those medications, which is great.
Awesome. I'm sorry, Katie.
Oh, no. I get excited and I just kind of jump in. Another thing, and I know we've mentioned it as part of the conversation, and I don't know if I would consider it a trend, but I think we're getting very creative and we're actually taking action to this now. And we've mentioned the social determinants of health earlier in the conversation, but I feel like now, instead of just talking about them in relation to population health, I feel like we're actually seeing the action items come. And we're seeing this really as a result of COVID, and primarily with a lot of the immunization strategies that we've seen, health systems rolling out. And, they're not going to come to us, we have to go to them. So removing those transportation barriers, there's, barriers of navigation. You're seeing this a lot more creatively now, rather than just talking about what these social determinants of health are. We're seeing the action come into play with them.
I think social determinants of health is a fantastic thing for a lot of reasons. The impact that it has for one, but also the challenge around, we can, most of the stratification and the analytics that Jackie was talking about, we can do as an administrator because we have the claims, but we don't know what their home life is like. We don't know if their refrigerator is broken. We don't know if the kids are truant. All this stuff is outside of the plan, and that's the other new kind of challenge. Maybe not a new kind of challenge, but unique now that we have technology for all the other stuff. And I think it's a wonderful. The call out is great. I think it's a wonderful place to spend a lot of attention for an employer. So any other thoughts on future expectations? I know there's so many, and we got 3 minutes left. So really quickly, the last question, which is similar to the same theme of the prior episodes. What are some no cost or low cost? So if an employer, maybe they're fully insured, right? So they're not seeing an immediate direct ROI on this stuff, or maybe some of these things take a while to realize the return on it, whether it's productivity or lower cost. Let's talk about what are the no cost, simplest, or low cost, right? Biggest bang for the buck things that an employer can do for their population health.
Yeah, and I can take that one. So, the first thing, and I know it seems so basic, but we see time and time again, so often an employer does not realize what programs are available to them. And oftentimes they might already be paying for these programs and they don't even realize that it's available to them. So I would say first and foremost is understanding what is in place, what do I already have, and then once identifying the programs in place, taking and leveraging and simply promoting and communicating these things, and not just a one and done, not just at open enrollment, making it a monthly or a quarterly, leverage EAP. Do employees know where to go to find that when they need it? Where's the phone number? Where's the email? How do I get in touch? You know, are there pieces of a care management strategy that are already in place, but maybe the participation's low because the employer's not promoting it? They don't realize what it is. So really understanding what's available and then leveraging that to begin with. There's no cost there. But then also diving into the data, as Jackie's, mentioned, looking and seeing, okay, do we have a high level of ED utilization? Well, maybe we need to educate to our members about other places that are available to go. And we should not take for granted that because most of us here are used to this knowledge and this conversation. I think oftentimes we take for granted that others don't realize that. So how do I get in touch with, is there a telehealth option? Is there an urgent care? My PCP, what's the best route for me to go? So once again, it's that educational component. Is there, as Zafira was talking, medication adherence? Do we have an opportunity to educate around medication adherence based upon what we're learning from our data and looking at that cultural piece? So why might our members not be adhering to the medication? What barriers are there that could be in place that we need to look at? So I think a lot of it is just taking and looking at what's available as the current state, and then just discerning, okay, what action items come from there.
I think that's great. We are exactly at 12 o'clock. So respecting everybody's time, and in the next meetings we have, really it comes down to is just not letting yourself get distracted by the eclipsing cost of the plan and moving past that for a second to look at the source, the root cause of those costs are the same human beings who will benefit from population health to be more productive, have a better life in their community around others. I think this has been a great conversation. Katie, Jackie, Zafira, Donna, and Renee, thanks so much for your expertise. It's always a pleasure working with you. And for everybody else, we'll see you next month. We're going to talk about behavioral health. Have an awesome day.
Thank you all.